The tension-free vaginal tape is for women who have stress urinary incontinence. Once those tissues are damaged, when you cough, sneeze, jump, run, anything that puts stress on that, you'll leak urine. So this procedure reapproximates the normal tissues so that when you can go back to your normal activities and not have to wear a pad, not have to worry about being in public and losing control of your bladder.
I was having urinary incontinence. Dr. Bascom told me there was treatment for it. Every time I, coughed, sneezed, ran, it was becoming a real problem. And there was this procedure, the mini arc TVT. She said it was great.
When Esther came in for a visit, she mentioned that she was having a hard time getting back into shape because she wanted to be running, but every time that she ran, she would leak urine. So we talked about the options for her. I discussed the mini arc tension-free vaginal tape procedure, and she was getting ready to start school, being a school teacher. She decided that that would be a good option for her, as did I.
The mini arc TVT worked immediately. I mean, I could tell the difference. I knew the difference had worked within a day.
The procedure itself is a very minor procedure. I do it in a hospital setting as a day surgery. The patient is asleep when I do this, but I make just a tiny little incision in the vagina, only about 1 centimeter long, and I clear the tissues away, and then I pass a little tiny tape that's about 6 centimeters long on either side, and then I look inside the bladder to make sure that everything looks fine with the bladder and the urethra, and then we're done. Usually I'll have patients off work maybe 5 to 7 days. Sometimes more depending on their job. So we do tell people to keep it easy for 4 to 6 weeks, but back to work very quickly.
My life has completely changed for the better since I had this procedure. I can do so much more without having to worry about the incontinence problem. I would highly recommend Dr. Bascom. She's very knowledgeable in the procedure, and I had full confidence in her.